So for students that are interested in physical activity, in LJMU we cover a range of topics and a range of disciplines. So in level 4 or first year, we look at the real basics. So why is physical activity important for health? What are the negative issues associated with sedentary behaviour? We look at how active populations are, and we look at things like guidelines from the World Health Organization and the UK Chief Medical Officers. Then in the second year, or level 5, we look at what influences physical activity and sedentary behaviour. So why are perhaps some people more likely to be active than others? We also introduce students to the concept of physical activity measurement, which is a really big topic in physical activity research and the physical activity world, because it's incredibly difficult to assess how much someone moves and how much they don't move. After the second year, we specialise further, where we look at physical activity across the life course, and we focus on specific groups of the population, and we look in depth at things like health inequalities. We also try and look at intervention design, so how can we design programmes that may encourage people to be more active and to reduce their time spent sedentary, and we look at how we can effectively evaluate programmes. In the third year, we also look at the effectiveness of physical activity as a non-pharmacological therapy for people living with long-term health conditions. So that could be things like the impact of physical activity on individuals that have things like gestational diabetes or cancer or mental health issues as well. There's also components on exercise psychology, so how can we try and encourage people to be active, how to maintain activity and be motivated to become active or maintain that activity. And there's also behaviour change that goes quite in depth using different models, looking at how we can positively encourage that behaviour change.